more on how the partial reopening of states could affect the fight against the virus here, we're joined by our chief medical correspondent, that's Dr. Jon LaPook. Jon LaPook, good morning to you. I broke it. I went out after 32 days.
Good morning.
I went out on Saturday. I was going to go out on Sunday. I saw the number of people out there. I freaked out a little bit and said, nope, not going out. So let's start with the basics. What should people keep in mind once you venture outside?
You know, Gail, I spoke to the CDC last night about this, and they are adamant. They're hammering home the point that it's not a free pass going outside, even if you're in a place where they're opening up. You still have to do all the things that everybody's telling you to do. The social distancing, the face mask, and absolutely you need to continue to wash your hands. I mean, it's so easy because it's an invisible threat. You're not seeing it. But I like what Dr. Burke said, which is, you know, you don't want to get infected yourself and then, even if you have no symptoms, pass it on to grandma.
So, John, if we're just outside walking around, if you bump into each other, could you get the virus that way? Just random bumps? That's what I was worried about. Is it that dangerous?
And you know, we're still learning things about the aerosolization, you know, how much, to what extent is it little particles in the air. But in general, the advice from the infectious disease experts from the CDC has been it has to be prolonged contact. And specifically, I remember asking them, you know, what about you just walking in Central Park? You walk by somebody and you happen to be 4 feet away, not 6 feet away. That's not what people are most concerned about. That's not what drives infections, this sort of casual contact. It's more prolonged contact where you're within 6 feet for some prolonged period of time, certainly more than 4 seconds.
Well, what's your message? You see people are getting very restless. They're closing in on each other. Some people are even using the phrase, it's assault on our civil rights when we're being told that we can't go outside. What's your message to people that don't think social distancing is necessary and that we need to get out of the house?
You know, this is a generation, this is a time when we need to be thinking about society as a whole, not about ourselves individually. You know, I spoke to Dr. Tom Inglesby last night. He's the infectious disease expert from Hopkins, and he was really interesting about how he described that it could be reasonable to start thinking about opening up, but you want to do it logically in areas, for example, states that don't have a lot of infections, Vermont, Montana, Alaska. And if you're going to do that opening up, do it carefully. You need to have enough testing to know what's going on, and you also have to have enough boots on the ground and public health officials so that if you do notice that there's an infection, to isolate the person, figure out who their contacts are, and do all the standard public health measures that we've always done over the years that are tried and true.
It all boils down to the testing, John. One question, if you need one question answered to better understand the virus, what is it for you? Just the one.
It's the question that we don't know is going to be asked tomorrow. Seriously. Every day there's something new that comes out, a new problem, problem smelling, problem with clotting, problem that we didn't predict. So I think the problem here is we don't even know the questions to ask right now, but I sure would like to know what the arc of this is going to be.
Yeah, you and me both. Everybody listening wants that question. Thank you very much, Jon LaPook.